Doctors in the house, and today I'm here with Dr. Alexander at South Texas Brain and Spine. Now, we have been visiting with them for several months, and we've covered a series of topics, including a range of things and issues that could come up with your brain and your spine. But it doesn't always require medical or surgical intervention, and we want to reassure you that there are things that you can do or attempt to do to prevent these things, or possibly try to heal yourself or give yourself some sort of relief. So where do we start with this one? I don't want to overstep on medical advice here.
Typically in our office, we usually treat patients very conservatively. So we usually keep surgery as our last option. So typically when we see a patient for neck pain, back pain, whatever the problems are, we usually like get imaging to look at what the pathology is, what's causing the pain and symptoms. That helps us determine the best treatment path. Most of the patients, I would say 95% of patients, we send conservative treatment and get them better without surgery. So everyone has this fear, I'm going to see a spinal surgeon or a neurosurgeon, and they want to do surgery. No, typically we try our best. Will it be a problem down the road? Yeah, it depends. Your body will keep aging, so it depends on lifestyle, depends on lifting things with their knees, not their back. So the conservative treatment usually we do on non-steroidals. Typically, narcotics is frowned upon, especially with all the narcotic abuse and restrictions. So we usually do non-steroidals, and we usually try like neuropathic medications like gabapentin or Cymbalta that helps with nerve pain and not habit-forming or addicting. Then we do some muscle relaxers, but those also can be, use them selectively. You don't want to be kind of used to it. Again, all medications your body gets used to, so you don't want to keep taking medications all the time if you can. Then the other treatment options are doing physical therapy. Sometimes we do chiropractic recommendations too, depending on the pathology and stuff like that. And then if they fail both of those, physical therapy, and then we send them to pain management. And that's where they do injections. They inject steroids, which is an anti-inflammatory and also helps with pain, with a little bit of lidocaine, whatever the pain doctor wants to use, and help direct it towards the site of the pain. So what they do is under pain management, they put the needle exactly where the problem is. So they direct the anti-inflammatory, the steroid, the lidocaine to the area of pain that help resolve that pain.
Okay.
If you do like an injection in your buttocks, that is a generic medication, but it's not delivering to the source of your pain. And it also tells me that's the source of the pain. It blocks your pain, but you can only usually do it 3 to 4 times a year. You don't want to keep doing injections, or they can also cause other problems like osteoporosis, other injuries, infections, those kind of things. So you want to do it too often. So, but that's a good treatment options in the beginning.
Definitely, and lots of resources out there. I know I'm constantly trying to keep in mind my core when I'm breathing, when I'm sitting, when I find my back hurting more. I try to focus on tightening my core and strengthening that, and that is something that takes a lot of effort, mindful effort. So these things take work, unfortunately. Like Doctor said, it's not going to be a pill or anything that fixes it, at least not permanently. So you do have to work on yourself, but I do love that y'all take that preventative approach or conservative approach before having to consider the surgery, which I think is great, especially for someone like myself. So if I was looking for someone that I needed a surgery, I would love to hear that from you before telling me that I need to go and get a big old scary surgery. But although none of them are scary here, because they're doing everything they can to take fantastic care of you. So if you find yourself in need of any of these services, reach out to our friends here at South Texas Brain and Spine, and don't forget to mention Coastal Living sent you.
Coastal Living's Doctor in the House is paid for by South Texas Brain and Spine Center.